This podcast is for informational purposes only and is not our intentions to substitute any information from your personal professional doctor on medical advice, diagnosis, or treatments. Listen to your body and listen to your doctor.
I think what's really big now is a lot of, let's say, insurance companies. In general, they focus on preventative care as well. So a lot of your preventative care treatment that you can have or screenings that you can have are free to most people for as far as your co-pays and things of that nature. Back to the mammograms, so recommendation, have a mammogram, every year until I think the age of 50.
Don't forget to like, subscribe, and share, and hit that bell for notifications.
Welcome to Wa-Keepin It Real. We're here once again with our panel of women. These are our friends, our sisters, and we're grateful that they're here with us today. We have Yolanda, we have Wanda, we have Angie, and they're going to introduce themselves and tell you a little bit about what they do, who they are, what they got going on, and we'll go from there. So, welcome to Keeping It Real. Yeah.
Thank you. Thank you.
Whichever one of y'all want to jump in here, go first.
I'll jump on out there.
Okay.
Hello, everybody. I'm Wanda Bill. I am a phlebotomist. I love these ladies here, my sisters. We go with Angie. We'll put you out on the spot.
I want to know who you married to.
Okay. Tell me about that. I'm trying to put it out for you. Well, my husband is Kevin Bell. I have two daughters and I have three daughters. Heaven Hookfin, Kyra Belk, and Kanithia Cook. That's my bonus daughter. And my granddaughter, Janaya. I have one grandchild. I love the Lord.
Amen.
And I'm so honored to be here today to share my story.
That is welcome. Glad to have you.
Well, Wanda want to throw me under, but I am Angela Strange, and I'm married to Myron Strange. I have one son, Stephen. I have three grandchildren.
Praise God.
13, 4, and 1. And they are really a handful. And I love them dearly.
All right.
To me, it's nothing better than knowing that you'll have a legacy after you're gone.
That's it.
So I thank God every day for my legacy. And I'm so glad to be here with my lady. Long life friends. And Eteris has been my friend for over 40 years. So, but I was only a baby when.
Right.
But I'm glad to be here. And I hope we have a great time today.
We welcome, and we certainly will. And then there's me. Hi, I'm Yolanda McGee, and I am a servant here on this earth. I've been placed with all these beautiful angels. I am a child of God. I am married to an awesome man. His name is James McGee, and we've been married for 37 years. We have 3 wonderful children. I have 2 amazing and talented daughter-in-laws, 9 grandchildren, so I'll say 8 grand, 1 great-grand. Like these ladies, or unlike these ladies, I'm not going to name everybody or ages. Because then I won't be showing my age, even though I know all my babies. I have one sister who really is 10 because she's amazing and she can be in 10 different places at one time. Absolutely love her. I'm a registered nurse by profession. I've been in nursing for 40 years. I've been a registered nurse for 23 of those 40 years. I also, I'm a military veteran. I retired from the Army after serving 20 years. So I'm grateful for that as well. They have asked me to tell my highlight of the week. I have 2. My number one highlight for every week is my grandchildren. because they always have something going on. And it's not that they're sending me pictures if I'm not there to show me what's going on in their lives. And that's a highlight for me every week. But yesterday, oh my gosh, we had an amazing time. So we meet our amazing group of friends here. We try and have an outing with one another at least once a month. And yesterday we had an outing in Pine Mountain. And so we went out to Pine Mountain. We had a great, fabulous lunch. And then we just toured the city of Pine Mountain. Oh, it was awesome. Just walking through, just seeing what life maybe not as complex as our own life day in and day out can be about.
Yeah.
So it was amazing. And just spending time, anytime we get to spend time together is amazing. So that was the highlight of my week.
Well, thank you. Well, we're glad to have you all here. Does anybody else have a highlight? I know you do. We just don't. Well, Yolanda covered that was good. She did. It's accepted for us. Well, we're thankful that y'all are here. We hope y'all feel comfortable, and let's get with it. Okay. So we have our first question. And this is for all of you. They're more in the medical field. This is my health, my wellness person right here.
That's everything.
That is she.
Come on now, come here. Honorary.
Is right. So I'm going to ask this question, and just both of you can bounce back and forth or whatever, or any of us. But well, first of all, let's say this. We are not
Experts.
we just had some health problems, but we thought that this was really important to bring out. So, make sure you follow what your doctor tells you. Your doctor way. Okay?
And plus, May is Women's Health Month, I think it is.
And also,
Women's Health Awareness.
oh, and also May. So,
It's also mental health.
So, yeah.
okay. So the first question, let's just get into it. How important is it to have your annual checkups, mammograms, pap smears, colonoscopies, vision, dental, whatever, and tell us about some of the suggested age and the time between checkups?
So I can start with that. It's important just to know your body as a woman, being in tune with your body. Say, for instance, let me jump on and talk about my experience with breast cancer and having mammograms, how important that is.
Right.
I was just sitting up on the sofa, and I get my mammograms done every year. So this was in 2006, right after I had lost my mom. I had just had a mammogram in 2005, I think. So I was just sitting on the sofa, rubbing on my breasts, just, rubbing on them. And I was like, I felt something, and it felt like a piece of cotton that was in my bra. So then I went in the bathroom, and I was like, this isn't cotton. This is something, you could feel it under the skin. So I played with it for 2 weeks, probably 2 weeks before I shared it. So I said, Kevin, I want you to see something. And he felt it. He said, oh, yeah, I feel it. So maybe it's your hormone. That's what I'm thinking. Maybe it's my hormones, my cycle, or whatever. So I went to the doctor, and she looked at it. She said, well, let's do a mammogram. And she said, it's probably not anything wrong, but let's just do another mammogram. They did it. It was, you could see it. And I went to the doctor, to a surgeon. And he said, oh, it's probably nothing wonder, but let's just take it out to see what it is. If you was my wife, I would want it out.
Right.
So he took it out by me working in the hospital, in the lab. It was Tuskegee Morehouse. You guys had a tailgate. And Kevin and I was on our way. I had the surgery on that Friday, and I'm like, I work in the lab today, Saturday. Why ain't nobody tell me about my results? So I called the lab, and I said, is the doctor there, Dr. Cliff or whatever? Right. And they said, no, he's not here. I was talking to his secretary, and I said, well, who's on call? She said, the physician was there. So he came on the phone very blunt, and he said, we do have your results, and you have cancer.
Okay.
So I got it before my doctor got it. And I said, really? So I said, I have cancer. I said it out so that Kevin could hear me. So we was getting dressed to go to the tailgate. So we I think we called and said that, we had something going on and we couldn't come because I totally lost it.
Right.
At that point. And so that was on Saturday. So then Sunday, Monday, so I talked to the doctor on Monday. The surgeon, he said, "Oh, Wanda, I was devastated. I'm so sorry that you got the results before I did, but let's get to surgery because your cancer under the microscope is aggressive. Like it wasn't there and it's aggressive. It's the kind that's aggressive. So we need to move quickly." I said, "Oh, okay." So that was on a Tuesday, and then I would always have Kevin, and because I could hear what they were saying, but I could never, you hear and stuff go so fast. Anyway, so I ended up having the surgery. I had 2 surgeries. One to see if the margins were clear. They were clear. Removed the lump, had chemotherapy, radiation. I was young. I was I was 45.
Wow.
Very young. Didn't have cancer in my family at that time. But I say, know your body. Get mammograms. Get checked out. Always stay in tune to what's going on. Your mammograms, your even your metabolic profiles, your BMPs, your CMPs, where they're checking your calcium, your sugar, your sugar levels. Anytime you go to the doctor, they normally do a routine test, CMP, CBC, complete blood counts. And those things look out for your hemoglobin, if you're having cycles, if you're bleeding, and other tests such as your hormone levels. I'm just really getting into hormone. They can really throw you for a loop and make you feel really, really, yeah. So hormone levels now I'm like, I encourage all women, once you get to certain stages, to get those checked. Just being in tune, being proactive with your own health, not waiting on a physician.
Right.
And another note, I know I'm probably going to talk, but another note is when you go to the doctor, don't, because you go into the physician and they talk these $1 million words. You say, "Can you break that down so I can understand? I don't understand."
Absolutely.
Ask questions. If it's things that you want to know, write notes before your appointment. Because when you go in the doctor's office with your note, you pull out your notepad, he is going to stop and listen. Because you forget things because they're talking really fast. So that's just a side note, to always write things down, know your body. My girls did something that I was not aware of. They went and had the BRCA gene mutation done because that's a test that you can have if you have a family member that have breast cancer. And so with me having breast cancer so early, my Heaven, my daughter, she did mammograms early, started at 40? No, actually earlier than that. And then Kyra they both did the BRCA test, and they came back negative. But you still need to just stay in tune. Stay in tune with your body. And for me, as a woman, took care of everybody, doing for everybody, moving, clicking, pop, just jumping and doing this and making sure this is going. If somebody says something, you just automatically run to fix it. Sometimes you just gotta sit back, take care of self, take care of others, but make sure you take care of yourself.
Yeah, because I would have
Because you can't take care of them if you're not well.
And absolutely.
And speaking, I just had a mammogram.
Right.
And I just got the results back, and I'm good, y'all. But the thing about it is I have dense breast tissue. So they recommend I get a MRI just to make sure. And I do have a family history of breast cancer. So at first I was like, well, I don't want to be just going looking for stuff, but it's important to be preventive. It's preventive, proactive, just making yourself aware. And I think for a lot of I know for me for a long time, it wasn't that notion of making myself aware. I go to the doctor and like asking questions. You get in there and you forget. So if you don't write it down, you just forget.
I think what's really big now is a lot of, let's say, insurance companies. In general, they focus on preventative care as well. So a lot of your preventative care treatment that you can have or screenings that you can have are free to most people for as far as your co-pays and things of that nature. Back to the mammograms, so recommendation, have a mammogram, every year until I think the age of 55 or somewhere around there. They say you can go to every 2 years, but most people are just comfortable with continuing to have that once a year mammogram. So screening is so important, and you don't need to have a doctor's order at most places to have a screening done. Right. So you can go in, you can have a screening as a self-referral. I just like to have a screening. Or if you're you have a physician, right, you can get a screening and they're going to send the results back to that physician. So just being screened, and as back to Wanda, just staying in touch and knowing your body. So you're always asked to do breast exams, right? Breast exams are a great thing to do in the shower, in the bath. And as you said, you were just sitting
there watching TV.
Yeah, doing the breast exam, because it does keep you in tune with your body. So you know what your body or what your breast feel. Absolutely. So again, just ever so important. And your time period, I think you said at 40. 40 is the age where they most recommend that you start having mammograms. However, if you do have a family history of breast cancer, first degree relative with cancer, or if you have had some kind of chest radiation, there's different reasons why you may need to have a mammogram sooner. Because I think we probably can all relate to or know someone who's had a family member who was 30, maybe even in their 20s, that were diagnosed with breast cancer. So just so important to stay on top of those things that are preventative. And, for me personally, I try and do all of my screenings on my birth month. That's how I can remember. I know, So, and my birth month is in July. So I just try and make sure I do all of those things, pap smears, mammograms, everything on my birth month. Some people say it helps them during that particular awareness month, like breast cancer awareness month being in October, because they're hearing so much about it in October, it works for them. Or colorectal cancer screening and awareness is in March, so then in March they think a lot about that and they'll go then. But for me, it's helpful. I try my birth month, and that has always worked for me.
That is a good idea. That is, as far as the mammograms, I've had them since I was 26. When I had my first child at 24, I didn't produce any milk at all. But 26, I started having all these nodules, and the wonderful Dr. Curtis Flemings. You have to have a doctor too that's going to be an advocate for you, because they didn't want to give me a mammogram at 26. So he advocated for me, and for a long time I had to take two a year. But I've had plenty of biopsies, and if I walk into Nukin, I go off at the door. They say you won't, but I do. And you walk at the secret place. But everything's been good and clear. So yes, you just have to do those things.
Yeah, good.
So, does anybody want to add anything about colonoscopies, pap smears, or we covered all of that? We're good.
I think again, the biggest piece to all of this is early detection and doing your preventative screening. Colonoscopies, they start now around the age of 45. They used to say 50. They back that down to 45 now to get your colonoscopies. Again, always in tune with your physician, because there may be something going on that will require you to do that earlier. And there's so much, again, when they go in there to do a colonoscopies are not just done for cancers. They also detect sometimes, some of your irritable bowel diseases or conditions that you may have. But they do allow them to see and detect early. And so we know anytime you can detect something early and treat it early, it definitely helps to lengthen your, life expectancy.
Right. I've never had the traditional colonoscopy, but I did the little kit.
Cologuard that detects for blood and see if you have your
It ain't pretty. I thought I would probably like to have the other thing done because
Right.
and I say that because you gotta be handling this. No,
Yeah.
you never done that one. The kid, I haven't. I've had friends that are sitting on this couch and said, "I'll take it for you."
And
I'll run by the house and get it and take it for you. But I have Crohn's disease, so yes, I have to have colonoscopies, and I have done that. And once again, it is preventative. I'm blessed because I'm not on medicine. Right. I have not been on medicine for a long time for that, but I do currently take a shot for it.
Yeah.
But I don't have any problems, and so that's a blessing. But you're all right, girl.
Yeah, it's a prep, really. I mean, because I put it off for a very long time.
Well, it's a prep.
It's the prep, the things that you have to drink.
I would rather probably do that.
Yeah, that's what she was saying.
She said she don't want. I don't want to do the little kid.
Yeah.
I would rather do that one than instead of the other one.
No, but I'm saying other people prolong because they're afraid
wanna
to
do
do
that.
the prep. But they had me, and when I had mine and the prepping, oh my God.
Yeah.
The drinking and but you are clean. When you drink that, you are super clean.
Yeah.
I think I dropped a couple pounds. And I was like, I like this as far as cleansing.
Yeah, but I do think that's the main
And then,
colonoscopy doesn't take long at all.
5 minutes.
They get that.
And it's the best sleep in the world. What you say?
He said that Michael Jackson does.
It
It is the best.
And then, again, if your results are normal, it's another 10 years before we have to worry about having something else done. And depending on, again, the results, some of them, if they see something or they can't see because you're not cleaning up, they may need to bring you back sometime, of course, before that 10 years to be able to re-examine and or look at something if they, see polyps that they can take out. But it's the prep.
It's
So
it's the prep for
still
me.
do that milky, chalky stuff. I know the last ones I've done were the Symphony,
Girl, they done upgrade.
The lab lady.
Mine was like a liquid. Yeah, Kevin did mixed it with Gatorade. So I do not like
clear
the tablets. I think it's the clear liquid and he mixed it.
Okay.
It's a liquid.
But it's a jug about like this. And you drink. So I don't drink yellow Gatorade for that reason. But you can't drink red or anything because you can't eat any red color or any color. So yellow was the best thing to mix.
Definitely need some more tallow.
And then Kevin would bring me the bottle, say, give me 5 minutes, drink. So then I drank it, and then he said, go on and drink it up. And I said, no, give me 5 minutes more drink. So I did.
I feel like you're full.
Like you're something here. Yeah.
Something else.
And then when you cleanse, when you're cleaning, as it cleans you out, you're like, wow, really? But if you're not like Yolanda said, you could go in there and not be clean. You will not get it done. Yeah. They have turned people away for that. Because you have to be clean out here.
That's true. So, Wanda, I want to ask you again. Would you go to some just everyday lab? If you go on the lab, or if you have some concerns, what's some of the tests that can be done?
The CBC, which is a complete blood count, that's going to be routine. A BMP, which is a metabolic blood count, and a CMP, is a complete metabolic blood count. And what the CBC is, like I said, it detects your hemoglobin and what your blood is. It also detects if you're having your white cells or your red blood cells are high or low. Right. And that can be an indicator that you may have some issues going on with your white blood cells or your red blood cells. They're high. Could be a sign of infection in your body somewhere. Metabolic panels, complete looking at your triglycerides, your glucoses and stuff like that. So typically when you have a routine lab, you're going to have a CMP or in a CBC, a complete blood count. Now, if you have history of thyroid problems, then they'll do thyroid tests and TSH. But mainly it's BMPs and CBCs. Checking your sodium levels, your potassium levels, your BUN and creatinine. And those things are geared towards your kidney functions, how your kidney is functioning. Sodium, some people don't have enough sodium, so it's low. And so, bless you, so they have to, take things, they may give you medication. So those type things, and now I encourage people to get on the portal system. If you have a lab or your doctor office have portals, get on them so that you can look at your results sometimes before the doctor can, so that when you do call, you can say, hey, this is elevated and this is elevated. What is that? Right. So that you are more in tune to what's going on as well in different labs.
I went on the portal. I'm not a portal person because I kind of get anxiety when I find out. My friend knows I just get anxiety, so I don't really want to know the specifics.
Right.
And I think that's okay because we're all different.
Right.
But the last time I did get on the portal, and I said, wait a minute, and I was writing stuff. So when I did go see the doctor, she was like, I am so proud of you.
Yes.
She said, but I also, maybe you're not a portal person. She said, let me worry about these numbers. Because and I said, I understand. And she says, but no, seriously, you do need to look at certain things. Because it depends on what's going on in your body, what you have. Your numbers may mean something totally different.
They will.
No, so.
Yeah, and so I tell people all the time, because people call me, and I said, first of all, y'all, I'm not a nurse. I'm not a doctor.
Right.
But let me help you with understand this. When you look at your results and compare, you're going to have your results and you're going to have the reference.
Right.
The results.
Yeah.
So you compare. So if your results is a 120 and the average result is 125, your results is a 125 and the average is 120, that's 5. That could be the way it was collected. It could be whether you were fasting or non-fasting, or it could be the instrument. So it's not all, you got to look at your numbers. If your numbers are 3,000 and you're at, it's that kind of thing. And it's high, because if it's off 2 or 3, it's the instrument is going to say high. It's going to read high or low. So it's not always, when you look at high and low levels, don't always get anxiety or say like, oh wow, this is out of whack, because there's several reasons why it could be. Could be that instrument is just, that's the way the instrument read.
But I think but I think the good thing too about that is that you're non-portal person that you did recognize it and you did put their attention.
Yeah. That's right.
Because Lab Wanda knows these things about the instruments or whatever, but you definitely she's trying to prevent your anxiety, which is a great thing. But the good thing is that you said, hey, let me kind of mention.
That's right.
Are we all looking at the same thing? I'm looking at it.
Right.
I recognize that, you may have 100 patients, but I'm me.
Right.
And I see this and I want to bring it to the attention just in case. In case.
And the doctors look, and you can also, and they do this too. They don't really say it, but they go back and look, okay, where were you last year?
Right.
What were, did anything change? And that's really big for labs as well.
Yeah.
Where were you last year? And then where are you now when you compare? And you can do the same thing. Go back and look at your results from last year or even years before that and see where you are.
Yeah.
Especially on your metabolic panels. Your glucoses, your creatinine and BUNs. If you don't understand the labs, ask the doctor to explain it to you.
Yeah. I think a lot of things in healthcare is comparison. Mammograms, not one backwards, but they always want to look at the last one you had. Compare it to this one. And so, when you were talking about the dense tissue, they do a lot to just kind of compare. Right. Where were we there?
And you said something a few minutes ago about them having 100 patients. They have multiple patients that they're seeing, and for them to really tune in on one patient.
Right.
It's
Impossible.
Yeah.
I mean,
It's unheard of.
there's systems, there's systems in place that should, so they may have 1,000 patients, but of course we do have technology and there's systems in place that when you order a test, they come back in, they fall into this bucket. There's a healthcare team, that are looking at, and they're looking at the results and to bring it to this is abnormal, flag system to let them know it's abnormal. But again, never hurts because you're your best advocate.
Right.
That's true.
When you see that, to say, okay, wait a minute. Hey, look at my result. This is what I saw. And 9 out of 10, they've seen it as well. And if it's something that was truly alarming or that they know they need to get you back in for or put that phone call in, that's a concern. We know.
Yeah.
But it's fine. And I think
That's good. That
top of what it is.
it makes the doctor's job easier too because it calls it to his attention, and he knows what to go over with you.
Right.
Yeah. What's your concerns? That's the lot.
Yeah, and I'm sure that really does kind of like give them it takes somewhat of a load off when you are aware of what's going on with you and you can communicate that
To them.
And they do, I'm telling you, they appreciate that.
They do.
Appreciate
They
some
really do.
some patients feel that I don't want to ask them any questions. I know they have a bunch of other appointments. No, they actually appreciate the patient that does come up because they feel that now we do have this relationship.
Right.
I do feel that they are being compliant when we talk about this is what we need you to do and this is why. Let's talk about this. What's why? And then when you come back with your questions, that's a good thing. It's not a negative thing. It's not never a time-consuming thing. Ask your questions. Always ask your questions. And I'm a physician that...
And you're not a doctor, so if you ask something, don't think that you're asking a crazy question. He's heard it before.
Yeah.
Just say, look, can you break that down and explain that to me, what that mean? And they'll do that.
And I know I worked with a doctor one time before, a neurosurgeon. And so we would sit there and we would talk to patients. And I know some of the things probably did, go over their head. But again, their mentality was, I don't think I want to burden him. So he would walk out and then they would say, Yolanda.
Yeah.
And then they would sit down and what did he say? And then so I was used to that. So the patient was keen. And then we would sit down and go over everything. Kind of that he just see. And we go back again. They were like, okay. But it is perfectly fine. And you should get comfortable as well. Or just kind of speaking in your position.
You are so
It's important to be comfortable with your doctor.
Oh, definitely.
And I've been blessed to have good doctors that tune into you. So do we want to briefly touch on the difference between autoimmune diseases, chronic and acute diseases? The differences. Okay.
So autoimmune is when your body kind of what I say attacks itself. The immune system is in your body to protect you. So when you have a autoimmune disorder, it kind of is working in the opposite. It doesn't recognize your body as being, hey, your body, this is my friend. So it kind of has an attack, and it can occur in different systems in your body. You can have autoimmune disorders in your GI tract, in your lungs, you think about lupus, which is a skin form of autoimmune disorders. I know you have Crohn's disease. There's so many different diseases that are autoimmune related. So that's how when you look at that, when you talk about, you say chronic diseases or conditions versus acute. Chronic is something that's lifelong. So, for most of your life, or is something that lasts over 90 days. When they use the word chronic, that means this is something that you really had over 90 days and or can be, life for the rest of your life. It doesn't necessarily mean that it has to be.
Okay.
But again, diabetes, hypertension, all those things are chronic. They consider to be chronic conditions. Acute, sometimes you get an acute cold. You get a cold, you get something that comes on and it goes off. It goes away. It's treated. It's coming. That's an acute condition. You can have an acute on chronic. You can. So you can have a condition, COPD, say chronic obstructive pulmonary disease. And then chronic obstructive pulmonary disease. So you can have that condition it can be on, in remission, not causing you any problems. And then you can have an exacerbation. Something happens that causes this to flare up and do all this. Okay. Now you have an acute on top, acute on chronic. So whatever made it flare up, when that particular thing that made it flare up is gone or treated, then you're back to your regular chronic. You don't have this acute problem where now I'm struggling to breathe. I'm doing this because we have something that's acute on top of something that's already chronic. So let's treat what we have that's acute. Okay. It's pollen season, it's whatever. And this is causing exacerbation of this person's COPD. But if we can get this under control, then we're back to where we are in our baseline with the chronic. So it's manageable.
That's good.
That's good. Yeah, that's good.
It's good information.
Yeah. Very good. Because it seems like in society now, everybody has, and I don't want to say this, but has one of these.
Yes.
Yeah.
Absolutely.
At least one of these.
Yes, absolutely. And you take care of the acute so that it doesn't get to the chronic.
Unless you have the ones that are right, autoimmune or whatever.
But 90 days is not a lot of time.
It's 3 months.
Yeah. How you going to treat it for those 3 months to get it back?
It just depends on
what it is. Yeah.
What it is.
Yeah, what it is.
But when you hear them say, when you go somewhere and they say, oh, well, this person has a chronic, just know that chronic initially, when we looking at time, if you're just looking at time, you're talking anything this person has had, they have a chronic cough. They've had a cough longer than 90 days.
Right. That's it. That's a good way of it.
Kind of right down fine. So then you start looking at some of the things, bronchitis, things that cause people to have chronic coughs. But can people get over bronchitis? Of course they can.
Yeah.
They can be treated and the bronchitis is gone, but it may have lasted over 90 days. So you're going to hear them say she has a chronic cough.
Okay.
She's had that cough over 90 days.
Yeah, it's just so good. It really is. So I was thinking about the autoimmune diseases, I don't know. Yes,
I can relate to that.
And when I found out that I had sarcoidosis, they were looking and telling me it could be lupus, it could be this. It took them a long time before they finally diagnosed it, but the whole time, I've already done my obituary, and because that's why I don't look at the portal. Really. I mean, it just, and when she finally diagnosed me, she was like, you have it way over here. You have the skin and arthritic, and you've had it all your life. I went back and pulled your military records from when you were a kid. But when I hear autoimmune, back then, it's been 30 plus years, I heard death sentence.
That's right.
Yeah. Yeah.
Well, because back then they didn't speak of any kind of cure for it.
Right.
She would get all these inflammations and get all these problems, and then the doctors would say, "Well, it's just not a cure for it." And when you tell someone that you're not really a cure for it, people start to think.
And at that time, they didn't talk about, because they were just really finding out, because I was pregnant.
That's right.
And I got chicken pox. And it was terrible. I mean,
all over her body, feet, in between her toes, in her tongue.
I can't remember that with Jazz or when I was training with Jasmine, Canero and Steven. I got it from Canero and Steven and
all of them had it.
But our doctor at the time, he called. He said, "Well, you can't come up in here." And I love him, but our friend who worked there, she came to see us, and she went back and told him. He came to my mom's house, and he said, had he known, he probably would have suggested for me to terminate the pregnancy. That's how bad they were.
They were everywhere.
Well, I mean, everywhere.
I'm saying everywhere.
Found out a year later, after I'd had her, they found out, okay, that's what I found out when I was 30, that I had sarcoidosis.
So you found that out during the time when you was pregnant?
After. And that's what they're saying, says your immune system probably was shut down. So,
and the net caused it.
Yeah, and so, hearing all that, not being one of those
people that, oh, let me be preventative.
Just not knowing.
Not knowing.
Yeah.
Back then, you just kind of tell yourself, yeah, this is it. You're going to have to raise my children.
But one thing that Dr. Fleming said that was so important is that he tried to talk to teachers and say, hey, stop it.
Yes.
I don't want to hear anything negative. That said this. But it wasn't coming from the other doctor. This was another doctor
that I had a relationship.
That's right. And he said, no, it's manageable. We're going to take care of it. You're not going anywhere. You've had this for a long time. It's just been dormant. And he started to explain it to her. And to get her mind off of that. But when you're 30, 31 years old and you hear something like that, you do have that feeling of, oh, I'm not going to make it. You know. But he was the one that said, hey, you know, you're a woman of God. Ain't nothing get ready to happen to you. He was so powerful to her, and it really helped change her personality over that.
I think lip session is big, and
It is.
that's big. Now, Jazz, then serve it today.
Right.
Yeah, I know, because it's manageable.
Yes.
Right. And it's about managing the condition. You know, yes, I have this autoimmune condition, but how do we manage? How do we manage it?
Right. Where do we go from here?
And like when I was diagnosed with the MS, immediately people were thinking deaths. For me, I wasn't thinking it, but they were thinking it because all they could relate to was Richard Pryor.
Yeah.
That was the first thing they were like, well, I said, I'm gonna live.
You have to.
The funniest thing was not funny, but it was just how, you know, when I went in, I was going in for testing, and it was a early morning. Good Morning America was on, and you remember, what's her name from the Mickey Mouse Club?
Annette.
Yes, and they were doing her story on Good Morning America that morning, and I was going in for testing, and it was like she was crippled. She couldn't comb her hair. Her husband had to do all this stuff for her. And I'm just like, I don't receive. That is not.
I know this.
I mean, I was going in that morning for testing. And I said, that is not going to be me. And I'm like, you speaking. The devil is a no.
You have to speak.
So that's
You do. So especially when because look at me in my 40s, breast cancer. I had people that I knew died from breast cancer. Close friends that I know left, co-workers. And so I had to get in that bathroom, and just say, Lord, it's just me and you.
right.
I want to see my child grow.
Right.
My 25-year-old child now. And I had to a lot of days, I'm going to be honest, because people will get in your ear. And I remember one day I came from the doctor's appointment. I was so happy. I said, oh, my numbers are good, you know. And they was like, well, so-and-so numbers was good. This other so-and-so had died. And I'm like, oh, wow. So when I went back to the doctor, my blood pressure was so high. And my Dr. Peoples was like, what is going on? And why is your blood pressure so high? And then I just broke down and I told him. He said, when your news is good, or whatever your news is, keep it to yourself. He said, because we don't need the street committee. He didn't call it that, but that's basically what it is. And so that song, Encourage Yourself. Honey, I sang that song a lot. Because I had to encourage myself.
Right.
Because I didn't want to hear what the next... Because people will put you in a grave, trying to bury you, and you be gone.
But I think too, people do that, but sometimes not with the bad intentions. You know, it's just the natural thing. You think about this, and some of them may say that, I don't know, almost in their mind as a sense of encouragement. If I tell this, maybe she did, but they don't know what that does to the person who's actually going through. Because everyone's different.
Everybody's different.
But you're right. You will hear every story.
You will hear every story. And so you really have to, you have to encourage yourself. And
surround yourself
with positive people. Christian women that motivators, encouragers that believe that God is a healer.
And we're going to stay with that. But, you know, Angie and I have been best friends for over 40-something years. I might not talk to Angie every day, but when I talk to her, she going to tell me what I need to know. She going to encourage me, motivate me. And so will you all. But we have to surround ourselves with positivity, you know.
Yes.
And sometimes it takes a long time to learn that.
Right.
The they and them.
And sometimes it's not what we want to hear, but it's what we need to hear.
Having us a good support system is so important.
It is very important.
Because I know for me, if I didn't have it, sometimes people don't know, like with the autoimmune disease, you don't see the symptoms. You don't see the pain. I could be walking around and I am in pain, but I'm still pressing. I'm still pressing my way. But then there are some days it's like, I just want to go home, get in the bed. And I come home and my support system, my husband, I said, I just need to go lay down. Say, you don't feel good? No, I don't. And I go get in the bed. And it's like, it's okay. If now if I had a husband like, no, you need to get in here and cook, that's not the type of husband I have. So it's good to have a support system.
That's good. That's right.
Good support system. And share that information.
Right.
Because if I didn't tell him,
He wouldn't know.
he wouldn't know. And it would be like, oh, she's got attitude. No, I got attitude. I don't feel good.
Right.
Medication is
Yeah.
It is today.
Yeah.
So we're going to talk a little bit. The last topic is mental wellness. Now, we've kind of been covering it a little bit, but I read this. It was mental wellness, affects your life, and your life affects your mental wellness. And there's just some quotes that when I was researching this, I found them that. The first one is, if you ask me what the single most important key to longevity is, I would have to say it is avoiding worry, stress, and tension. If you didn't ask me, I still have to say it. And that's George Burns. And he lived to 100 plus. And how do y'all cope with stress and tension and
I'm a fixer. I feel like I'm learning that you can't fix it. It ain't for you to fix. Stop worrying. I am learning to give it to God. Trust God. Now my husband, he don't tear the church down. He don't go every Sunday. He don't. I would love for him to do that. But a relationship with God, he has. He would get up early in the morning, 5, and be praying. He prays for everybody, everything and everybody. He has done that. And every time I talk to him about something, baby, you got to trust God. You got to trust God. And I say, but I know I do trust God. He said, then give it to him. Give it to him and let him handle it. So that's where I am. I'm learning to really, because I give it to him, but then I go back and give it. Okay, God, I gave it to you, but let me look and see what you're doing. I have learned to give it to him and let him deal. I can't.
Yeah.
And that helps me. Because before I would worry, sit up at night, twiddle my thumbs. What am I going to do? Because I want to get in there and fix it. Well, what can I do? Maybe I can do this. So maybe I can go and I ain't trying to do that no more.
Right.
I don't, God, I'm giving it to you. That's how.
That's where I am as far as prayer life.
Yeah.
Just praying and daily devotional. When it comes to just, let's say, work. I want to sit outside my car even when I get to work and before I walk in there. And pray when I'm at home. But right there in the parking lot. Talk to God, and I know it doesn't matter what the particular situation is. I know who's right there by my side, so I'm ready to go. However this goes, I'm going to go in here. I'm going to give it my best, 110%, and me and the good Lord going to walk hand in hand and sit on back in my chair. Well, that's right. But that's what I have to do. I've learned that if the situation is not in my lane, or not in my control, do what I can do. I can pray. I can pray for the situation. I can pray for this group of people, I can do this, and that's what I'm going to do. And ask God, the same person who's going to help me. Amen. Right.
That's a help. Yeah.
So that's huge for me. It really is.
Man, that's the most laid back lady I know.
Who was that?
She won't let nothing.
Oh,
And she would never have a piece of sweat coming off her. Coming off that head. Never.
yeah. Who was that?
You. What's that, man? You do. All is cool. It doesn't matter what's going on. But it's so ironic that you say that because yesterday, I had someone to say something to me that was disturbing for about 2 seconds. They told me that they have not liked me for the whole time they've known me. And they didn't like me because of how I look and how I carry myself. And I'm always in a good mood. And they had to confess to me. And they were sorry for how they treated me all those years when I've still just been nice to them and not even paid attention to the fact that they really didn't like me. But God has a way of just showing you, keep it in that same lane. It doesn't matter. You do you. And people will come back.
That's it.
And they'll come back and do right. Because I got a whole bunch of problems. But guess what? We all got them. I don't keep smiling, keep trying to take care of myself because that's what's important.
Right.
And that's what's going to help everybody else as well.
That's right.
And keep them on the right track. So that was very, very crazy. And she was just so, I spoke to her. She had like, she didn't know who I was. She said, I knew who you was, but I didn't want to speak. She said, but it just bothered me. And
She was convicted.
so isn't it amazing?
Yeah.
How you can let people think that you just got it all going on. Because I really do now. I got it. I'm not trying to act like I got it going on. You got it going on. I tell people at work, I just make it look easy.
But you're blessed.
That's it. That's the main thing. And you happy within yourself.
I just love myself. I just, that has to be my thing. I can't let it.
And I even when I see you, you're smiling, you're blubbing. You encourage me. All y'all encourage me. Really, you do.
It's just crazy how life is, though.
But mental health is just, that's a whole topic in itself.
Right.
Yeah. Just how important mental health is. And, for years and years and years, how you guys were speaking about autoimmune disorders and how you just initially thought, right. So many years ago, maybe 10, 20 years ago. Of course, there was always just a stigmatism over mental health. And they're afraid to speak up, when they may have had, some kind of mental health disorders or mental health issues. And then there's all the stigmatism you have with therapy that, mental health has got to be talked about. It's got to be treated just like any other physical health problem that we have. I had a relative who was bipolar, and she just did from time to time would just want to come off the meds. But I said, it's just like, you can look at early forms of diabetes. If you have a particular type of diabetes where you need to have insulin, you've got to have it. Without it, you're going to have some serious issues and could lead to death. Same thing here. It's just, when you say, oh, well, I don't want to take that medicine, I don't want to.
Right.
Take your medicine, because you're so concerned with everyone else thinks and says about you, but you need that balance. And then not all mental health issues, that's the other thing, not all mental health conditions require medicine. You have psychologists, you have psychiatrists. Most psychiatrists are the ones who treat with meds. Psychologists are your counselors, therapists. And so sometimes it's just about having a therapist, someone that you can speak to, a professional that you can speak to that can see what's going on with you. So mental health is important, and just the stigmatism that used to surround it, hopefully is fading away with all the education that's under now about mental health. So just speak up and talk to people. I think it's the most important thing.
I can say back in the day, mental health was not talked about. It was like hush hush.
Yes.
It's sort of like that Uncle Pete that had the room down the hall. What's wrong with Uncle Pete? You know, Uncle Pete.
Water a chair to go down and water a tree every day. Every day.
Yeah.
What's a little bit of chocolate tree? They said he was watering the tree all day, sun up to sundown. People say this is what he did. Okay, not today.
Right. But they're human. Back then, as a kid, you know, we would run and peep down the hall and run back and laugh because we didn't really know any better. But today, it's real. And I mean, and we work with people with mental health. We go, we shop, we're surrounded. You never know how, advanced or what level it is. But they're God's people. And we still have to love them and love each other.
And you have some people with certain mental health conditions that don't come about until they go off to college.
That's it. That's it.
Prior to that, they did not have or it wasn't noticeable, had not come to the surface. And so can you imagine how confused this child is? When I say child, they're 18, some people say 18 are adults, but how confused they are. They don't want to speak up about what's going on at this particular time. But again, it's important to educate at a young age, that when you have something that where you feel different, you feel taught to someone.
Right.
That's important.
That's true.
And I do want to say, I think for me, when I'm not gonna say the word, when that pandemic thing was going around, I think that's what really awakened that in me to be more concerned about my mental health because it's like we're locked in. No, we're not locked in, but it's a
good word.
And then with us, we were in the office, out the office, in the office, out the office. And that did have an effect on me because it's like, okay, this is just getting too much. And I was like, okay, I've got to make sure I'm making sure I'm okay. So I had no shame with getting on the thing because we do and some insurances give free
Some companies
sessions. And I'm not ashamed to take advantage of it. Not that something is wrong with me, but if it's there for me, available for me to get,
absolutely.
Take advantage of
And I
it.
encourage people to use that.
Right.
Those 6. A lot of them start out with 5 and 6 sessions to speak with someone that knows nothing about you or nothing, but they're there to listen. And they're trained to listen and to help you in those areas because, that was a lot. And that term locked in was exactly what it was. I felt that too. And I was at the hospital. But people in general felt that. That C word had a lot of effect on a lot of people.
Yeah, absolutely. So, and listen, I never really believed in, not for me, but it came out wrong because it was a blanket statement about Xanax and all that until life starts life. And I still denied it for me. And it wasn't until after, my parents passed, and COVID, my brother passed, but it goes back to having a good, and I try to keep things away from you guys, but it went back to having a good doctor, because after my brother passed, it was like 6 months. I'd seen her, and she came in after 6 months because I go after 6 months, and I just bust out crying. Just bust out crying. And she says, "It's enough. You need a little help." That's it. She said, "It's okay. You need a little help." It's okay. It is. And she said, "I kind of follow you. I know you got good friends. Talk. Talk. And I'm going to put you on this prescription. You need a little help." Yeah, and I'm thankful for the doctor, and I'm thankful for great friends. I am most thankful for the Lord. So, that's good. That's good. Being in a place that you can reach out and know. Yeah. And she knew me. And I thank God, too, that the Lord has a sense of humor because he's like,
stop telling my people they can't get on no medicine or talk to people or sit on somebody's couch or sit on their own couch. And I'm like, let me show you, girl. Yeah, in love. So.
And that, what you said, that it goes back to when I was first diagnosed with the MS. To tag on what you were saying, by God saying, stop telling me. So they wanted to put me on medication in the beginning, but I was exercising, doing my eating regimen, and I was fine. But I had this neurologist. He said, you need to be on medication because you're going to end up in a wheelchair. I was like, no, I'm not.
Right.
And so when I did have a flare-up that put me in the hospital, the doctor said, you need to be on medication. Still, I'm contemplating in my mind, I don't want to get on medication. And I went to church that Wednesday night, and the teaching was on naming and how he was told to go and dip in the Jordan and he would be healed. And so it wasn't done the way that he thought it was going to be done. And God had to tell me, stop trying to make it like, if you don't take medicine, I can't do what I need to do.
Because I can still
do what I need to do, regardless.
It's powerful.
So you ain't got to prove I am who I am by what you don't do.
I use what I want to use and who I want to use.
Like,
Yes, how I want to use.
That's right. It's it.
Which one? No, that's right.
So now it's like now when I do my inject, I inject 3 days a week. But it's like it's just going through the motions for me. Right. I know it's doing what it needs to do, but at the same time, I know who is in control. And it's like, well,
Thank God.
But yeah, you made me think about that. You said
That's good.
You ain't gotta prove who I am.
Exactly. Then he said, "Tell him I am sent you," and that's powerful. There, I am, and you fill in who I am.
Right.
Okay. Yeah.
We have other healer.
Huh?
Our other healer.
Yes, I heard.
Yeah.
Get right into that.
Yeah.
So one of the other quotes is
Being a healthy being starts from the inside. And this is our segue to Miss Angela Strange. Just like
with that information. I need it.
We want you to give us everything you got. Tips and whatever. I don't think I have a lot of tips, but you know, because I've been to the doctor and he's talked to me about, you know, you better get it together. You hit it downstream, because I was eating a lot of fast foods and my job kind of had me stressed out to where, hey, I can get this, it'll be fresh, I can move on, but I didn't realize what it was doing to my system. And I started a system, and I was at about 223, and I went to the doctor, and he was like, keep on, you're going to about 5 or 6 medications you're going to have to take, and blood pressure is really high, which I still have a problem with blood pressure now, but it's nothing like it was before. But I had to do something, and I started little things. And just through, I had a couple of people that really helped me through some stuff. But one thing that I really know, and I know when I tell y'all this, everybody wants to have a bad taste about it because it's about not eating. And fasting is probably one of the best things you can do for yourself. And when I first did it, I was messed up. I had headaches. I was a little dizzy, you know. But I think it was just all in my mind. And I started the Beyonce diet, which was the lemonade diet. And I did that for a couple of weeks. And so many things started to change for me. Not just physical, but mental. I even had more clarity, I felt like, because I wasn't eating. And eating the fast foods and eating the processed foods and eating the salt and vinegar potato chips and me drinking my knee-high sodas and all this stuff
was really taking a toll on my body. So when I first did the Beyonce, it was okay, and I did it, and I took care of it, and then I did it again. Then I waited a few months, but every time I did it, I got results, and the weight never came back. That's the most powerful thing. The weight never came back. Now, yeah, I went to the gym, and I was working out, but the weight never came back.
Jesus.
And that told me that it really, really worked. But I don't know, and I brought a little prompt today because when I was a little girl, my grandmother, every season, she would come with a cup and a lemon or orange. And she'll say, I need you to drink this, and it's warm, and you're going to do it.
Yes.
Oh, wow.
Castor oil. And my trainer told me, he said, you need to clean out. You're never going to lose weight. Your stomach too fat. What? He said, you're going to have to clean out. And this is what you're going to do.
Jesus.
So I was like, I did that when I was a little girl. He said, okay.
Yeah.
And how did you feel when you were a little girl?
All right. You're right.
I said, okay. So I started out doing a little bit with the orange like my grandmother did for me. And then I do it now with coffee because it's warm. You can pour it in there. You can just kind of drink it, you know, a little bit. But everybody can't do it with coffee. And I know it seems crazy, but I have probably about 10 people. If they get sick, they call me and say, hey, I need you to make me your concoction. And my concoction, and the concoction is a castor oil. And I mix it, and I try to, sometimes I have one truck driver that wants it every 3 months. And
Wow.
he said that his numbers are better because they have to go through some testing
When they drive.
So so he'll call me and say, hey, you got my stuff for me? And he said, this is the best thing. I try to tell people about it, but they don't listen. But he said it keeps him cleaned out. And
That's the key.
being cleaned out really helps. So I suggest anybody at any level can at least do a 1-day fast. And when they do their 1-day fast, to do this. So you do your 1-day fast with no food and do just
Clean yourself.
a castor oil to keep yourself clean, because Monday is the best day. If I do a fast, I'm going to do it on Monday because you got the whole week, the weekend, because you know we do on weekends and everything. And y'all, I drink beer, so you know it's really bad. And so not like I used to, but I still want me a beer every now and then. So that helps. That just helps get that mucusness, because it's only mucus in your body.
Yes.
And I had to find out that mucus and inflammation will have you sore. And people say, I went to the gym for 3 months and I was sore the whole time. I said, because the inflammation never left your body. But if you fast, if you do just 1 day a week, it will start to have an effect. Now, you're going to have a headache. Everybody, or you're going to have a little dizziness. But that's because you haven't had those things. You have your muffin that morning, or your cereal, or your coffee with your cream and all that good stuff. And all of that causes you to have a reaction. So if anyone's just trying to change a little bit, just do this once a week. No food for 1 day. And your body gets to rest. Your organs get to rest. And the lemonade really works if you get molasses to put in, get a gallon of water, add a little bit of molasses, about 4 lemons. Just take the lemons and squeeze the juice in there real good, and get you some cayenne pepper, just a little dash. And the cayenne pepper really goes through your system really fast, so that just keeps you going all day.
Prompt with that ring down here.
And then you drink, and still try to drink water. If you feel like you need more water, and you're not gonna get sick, you're not gonna pass out. You're not going to have to go to the hospital. It's just a 1 day. Now, if you want to go on a longer length, then that's when you get with your doctor and say, hey, I want to really cut back.
Right.
And intermittent fasting is very good. Even if you just do that once a week. I do intermittent. I really don't eat till about 2:00. So about 2 to 8 is when I eat. 2 p.m. to 8 p.m. And I try to, and I can't do 6 because I don't get off till 6.
No way.
And so I do 2 to 8. And if you do that, you really compound your calories in your food, and you still end up burning more calories, and you get used to it. Right. You cut yourself off. The snacking was always my problem, because around 1:00 or 12:00 at work, I would just grab a bag of chips or, something quick because I know I'm going into a meeting or I got this going on, and it starts to catch up with you.
Yeah.
Now, am I perfect? No.
Yeah. I think we said in the beginning, which is good too. I think we gave the disclaimer in the beginning too. Already did the health disclaimer. I think when they said how we were the doctor.
Right.
But I
no way.
Definitely, want to say that again for us here, because I believe in everything. But again, if you do have a health condition,
that's right. Talk to your doctor.
Talk to your doctor. So if you have a health condition where you have diabetes, you have to take insulin out. You always, before you do something like this, want to make sure that they're aware.
Absolutely.
That you are going to try this, because there's certain conditions for which there will be something that you may have to put into your
Absolutely.
But you already said it, I think, and working with your doctor.
Yeah.
Certainly.
One thing about the castor oil, don't get. A lot of people have a myth about going to the bathroom. Don't be worried about going to the bathroom. It's a natural thing. And people get really caught up on that. I want to go to the bathroom. You need this, but you need it. Your system needs to get rid of waste, mucus. A lot of times you have a cold and you think, this will keep the colds and a lot of the infections down. So don't worry about going to the bathroom. It's natural. Everyone does it. But I have one more thing, and this is something crazy. And I had a young man that worked with me some years ago, and he had a sore throat for a couple of days. And I told him to go buy some peroxide. And he was like, what am I going to do with this peroxide? I said, I need you to gargle in the morning after you brush your teeth, and at night. And I said, probably the next day or two, it's going to, you won't have a sore throat anymore. He said, yeah, okay, Ms. Angela. I said, please, just try it. And he did. He was young. He was a young man, graduated from Georgia Tech, very intelligent. He came back to me and he said, I don't know what you told me to do, but my sore throat went away. And I gargle with peroxide. I know it costs about, what does it cost about? 60 cents? I mean, about $1 or something now. Yeah. But if you gargle with this, it helps to get all that phlegm all up in there, when you be thinking, oh, this is clogged and all of that stuff just kind of goes away when you gargle with this. And you can see it when you spit it out. Don't swallow it, just gargle, get it in there real good, and keep
you mix it with water.
And if you all go to the dentist, he gives you this with some water before they ever start working on your teeth now. And they started doing that after, all the diseases started to come out. So this is something that's really natural. It's not going to hurt you. But if you have a sore throat, or if you feel like your gums are kind of, just take this and gargle with it. It's very inexpensive. It's better than being on all the antibiotics. A lot of times we be taking antibiotics for a whole lot of stuff that we might not even need. And you need to give it to your doctor. And if you have a sore throat and it doesn't go away within a couple of days, then you need to see your physician. It's something else.
Yeah.
But just a simple little sore throat, a little tickle, try it.
I think I remember one time when, years and years ago, it's a dentist or someone was when I was rounding in this dental clinic one time. But anyway, the techs would tell people when they had really bad halitosis or bad breath. That's right. One of the things they told me to do was to gargle with that hydrogen peroxide.
Wow. Because if you notice when you put it on a
It just
sore,
bubbled. Yeah. It just go to
cleans
work.
all that and the germs out.
Yeah. You know, a lot of
When you
people
have-
that have, what are those, the canker sores?
Cankers.
In the jaw,
Oh.
tell them that too.
They call it
Because it's not
a
so,
little thing.
it's not gonna burn.
Right.
Yeah.
It just
The alcohol.
Yeah.
Has that
Yeah.
alcohol in it.
that is some powerful information, Angie. I thank you for that.
And so I always use my husband as a guinea pig, and he gets so mad at me. Okay, Byron, you know you get mad at me, but he knows that it works, and I'll catch him doing it. Yeah, I catch him doing it. Yeah.
And he know the
Yeah. We have this little cute concoction that I do now is ginger, turmeric, a fresh pineapple. Everything's fresh and natural, and a little bit of cayenne and a whole lemon, and I blend it. And this is our shot in the morning, so we use the shot off in the morning to start our day. But it really helps with inflammation. It really helps.
Yeah, that too.
Like that. And I have my hairdresser. When I met her about 10 years ago, she told me, your stomach's so fat, you got to do something about this. So she's another lady that really helps me as well. So it takes a lot of different type of things to get you to where you need to be. But just trust people. Everyone's not out to tell you wrong information. There's a lot of people out there that wants to help you and not need monetary measures behind it. And I walk on my lunch pretty much every day, which is 5 days. And then a lot of times I might do something in the evening. I was going to the gym in the morning, but I need to get another membership. So that's going to be my goal, though, to start going back there at 5 in the morning and doing my regimen, keeping it moving. But I'm just trying to manage my weight right now. So I try to keep it at 150. If it gets to 152, 153, I'm like, ooh. Got to get back down, but just manage it. But still try to live a good life. You want to have a good time, enjoy stuff, but I just try to do it in moderation. And that's not just because I want to. I have to. I have to keep my numbers down. I have to keep my weight down.
That's it.
So I can live a good, healthy life and not worry about worry about my future, because everybody's not prone to having a six pack or just eating what they want and being able to do what they want to do. I'm not that person,
Right.
so I have to work at it all the time.
And the thing about everything you just talked about, it's really nothing new. When we were growing up,
That's it.
this was all the stuff that was used when we were growing up.
Look a little children.
And we got away from
Oh,
And diseases weren't even. A lot of stuff wasn't even heard of back then because of these natural
right.
things that people. Yeah.
And I get it, medicine advanced and it has its place, but at the same time, those things work.
Yeah.
And I think it's just being consistent with them, and having the patience to do it.
Yes.
Because you can't just go buy a pill and pop a pill.
Thank
You
you.
have to put in the time to be disciplined.
Yeah.
And so it's like either I want to really make it a priority to take care of myself, and if I want to do it in a natural way, I have to be willing to put in the time to do it.
Right.
So, it's a choice you have to make.
Absolutely.
Because I tell people this all the time. My mama gave us cod liver oil.
Oh, yes.
Janaya, expert.
That's right.
That's right.
And we did not get sick.
We did not.
It was no, come pick Joaquin because she got cold. She had school. She said,
No,
that wasn't
You're going to
there
school.
was not any of that. I only went home.
right.
I only got picked up from school one day out of the month, and that was because I cramped.
Oh, yeah.
And I was so sick that first day.
Yeah.
That was the only time.
Yeah.
But as far as like colds and constantly going to the doctor. There was none of that when I was growing up. So it's like we've gotten away from it. And so it's just
It was
getting
so
back to
funny.
those
We was
things.
at my brother's house some years ago, and all the kids was sick with cold, just running nose, just coughing. I lined all of them up. I said, "Come here," and I gave it to them, and they was like, I said, "Come on," but they felt better afterwards. Now to this day, Janiyah will say, "Grandma, we got any castor oil." She'll take it,
She'll take it.
yeah, but
She's like, y'all the old song.
she is the other summer. She'll take off. But the other ones, they were running like, no, but they all felt better. Yeah.
Do y'all
Because it's not,
I
yeah.
remember when we would have chicken pox amongst everybody. Y'all come on, get it at one
Yeah.
time.
Everybody gonna
Yeah, bring them over here.
One time.
Heard it.
It's like, go, let's go. Come on. Let's go. Y'all know everybody. Everybody.
Yeah.
That's right. That's right.
That's something, yeah.
They work.
But you said it. Know your numbers.
Yeah.
Perfect. Know your numbers.
and drink water. Like you should drink a half of your body weight in ounces. So if you weigh 150 pounds, 75 ounces of water a day
Okay.
to keep
That's why I'm getting to
keep you
flush them organs and stuff on.
keep you. And that's hard to do.
It is.
A lot of times because you get caught up. But I always tell people, drink it when you first wake up in the morning. That's your first thing. You got 16 ounces over it. And then, like, if you're driving to work, that make that your second one. Just drink it on up. So now you're already down 2 bottles before your day even gets started. And then you can kind of,
That's why I was sitting here like,
you know, because a lot of times, you know, you take your meds or anything in the morning, just make sure you get that whole thing down. And then when you're driving, you listen to your music or whatever, just drink one more. And then we're down 2.
Right.
yeah.
So it makes it a little bit
Make it
easier
count.
during the day to try to get the rest of you know to get it helps to get you. Yes, it does. Helps.
The first and type,
Yes.
with you if you're full, if you're just drinking.
Yes.
And it really helps with your skin. Because
Yes.
I've been drinking much more water than I've ever drank.
Yeah.
But me drinking water
Would rather
really helps.
stuff.
One more thing before we end this, and this has been really good. This is for everybody. What are some things that you do that get you in a happy, healthy, and joyous place? Mindset or just your personal things. What's some things you do? I'll start. I will. I get up in the morning now, and I whether it's music or read word or something that's encouraging. And then when I finish that, I turn that music on. And sometimes, most of the time, I haven't had it's gospel or something, a song that's just gonna, and I just dance like I am Usher's background dancer. I do, you know, and it just gets me. I think it gets, what do they call your going, and it just, and I am a more endorphin. And the last thing I do is I journal. So if you go back and read what God has brought you through, you can't. I don't have a choice but to say thank you and be thankful. So that's for me.
I think walking for me is my my thing because it gives me a chance to be by myself and disconnect with the world. And I'm always thankful for what he does for me, and I guess that gives me the opportunity to talk or I'm reading, you know, I'm listening to something. And journaling is very important for me. I think I've been journaling since I was a young girl, and I need the journaling because I want to say a lot of things to a lot of people, but I just put it in a journal, and it helps me to keep it moved down because I feel like I've already said what I need to say, and I don't have to say it to who I want to say it to.
That's the way I think.
Like that's never good.
I think for me, it's actually the opposite of the music. As much as I love music, y'all know I love music. It's just quiet. Peace, quiet. Like, you know, even if you wake up on, I know you said daily, but let's even think about a weekend. If I wake up a lot of times the first thing that people do, I know my grandkids, they turn the TV on. So most times for me, it gets me where I need to be. That gives me that time to just have thought and just listen to what the Lord may be trying to tell me. It's not to have anything, just to have peace and quiet and just get. If I'm moving around to get ready to do that, I don't want anything on. Okay. Sometimes people say, "Did you see on it? Did you hear on the news?" I watch the news at night. I do. I try to every night, 10 o'clock, 11 o'clock. But in the morning, this solitude of just everything being quiet. That doesn't happen. I'm saying, but on the weekends it can. Right. It doesn't happen because I'm getting ready. My husband's getting ready. He generally leaves before I do. And then I can just go into a quiet space before I get to let me see. Have something to.
That's kind of mine too. Yeah. It's just I can come here, and if I'm here by myself initially, and I don't turn the TV on, and the house is quiet, and it's just a place of solitude for me. I can be doing whatever I'm doing in the kitchen. I can be cooking, right, and I don't have to have the TV on, music on, or nothing. I ride in the car sometimes. Sometimes I will take a lunch, come home, then trip out. But I will ride in a circle from here, Moon Road, come back, go back to work. No music. It's just me in the car, quiet, and I'm talking to you.
For me, is lately, because I've changed what I do in the morning. I just get up and I just spend some intimate time with God, just talking to Him, not asking for anything, but just telling Him, thank you for everything. Right. Thank you for this day. And I just go all down the list, and I just thank you for X, Y, and Z, for keeping me, for keeping my mind. And then I start praying for people, my loved ones, and I ask Him to bless the works of my hands, that whatever I touch or whatever I'm surrounded with, bless it. And then I go home and I get to work sometimes. This little girl, she from the Philippines, she took me, she said, and I didn't know that she was paying attention. Okay. So one day she came, she said, Jesus, Jesus, Jesus. You know, they have an accent. I said, what's wrong with you? She said, it works for you. I be hearing you say it. And I do say that, but sometimes I'll just say Jesus. Yeah. You know, that's just me, you know. Or bless God. And she said it. I said, it does. I didn't know you paid me no attention. She said, yeah, I had to call on him because that lady up out of here, you know, and I said, yeah. Sometimes I just say Jesus, and I just do that. Yeah. That's just me and me connecting to him. Right. It's just Jesus, you know. Yeah. It works. It works. That's what she said. It seemed to be working for you over there. We have our little workstations. Yeah. So that's what I do. I just thank you.
Well, ladies, this has been great and informative. I've enjoyed, and sometime we'll get back together with more information. This has just been a blessing.
It has been.
And we hope that you guys got as much as we did out of it all week, or even us, that we learned from each other. And we hope that we're being a blessing to someone. And information is good.
Something that you hear or heard on this panel today, you can take it and it can be a benefit to you. Please know that you need to consult with your physician to make sure what you are going to do will work for you. That's right. So with that being said, thank you for tuning in today to Wa-Keepin It Real with Joaquin and T. And we just hope you have a blessed rest of your week. We love y'all.
And one more thing, we're going to have to go because I have to go get me some castor oil. I do raw castor oil. So, yeah. So, goodbye.
Don't forget to like, subscribe, and share, and hit that bell for notifications.